Good afternoon to our viewers in Germany and good morning to our viewers in the United States. I'm Steve Sokol and I'm the president of the American Council on Germany. I'd like to welcome you all to today's virtual discussion about global public health priorities during Germany's G7 presidency. This event is part of a series of events which is being organized by the ACG and the German Embassy in Washington, D.C. to highlight the issues on the G7 agenda this year. I think it's fair to say that before the war in Ukraine, global health was one of the main priorities on Germany's G7 agenda. And as the running joke goes, we might be tired of COVID-19, but it is not tired of us. The pandemic continues to take a toll on people all around the world. I think many had high hopes that we would overcome COVID-19 in 2022, but so far that does not seem to be the case. Prioritizing global healthcare has not lost its relevance, though. The question is, can the G7 lead global health efforts and commit to strengthening global health structures and to improving future pandemic preparedness in the face of new challenges? To help us answer this question, we're joined today by Dr. Nicole Lurie and Professor Dr. Veronika von Messling. On behalf of the German Embassy and the ACG, I am delighted to welcome both of you and our moderator, Arthur Allen. All three bios will be posted in the chat. Nicole Lurie is the U.S. Director of the Coalition for Epidemic Preparedness Innovations and previously served as Assistant Secretary for Preparedness and Response in the U.S. Department of Health and Human Services. Nicole, thank you for joining us.
Delightful to be here. Thanks so much for hosting this.
And Veronika von Messling is the Director General for Life Sciences in the German Federal Ministry of Education and Research. Herzlich willkommen.
Thank you for having me.
Journalist Arthur Allen will lead the discussion. He's written extensively about healthcare and COVID and has been a senior correspondent for Kaiser Health News since April of 2020. Arthur, thank you for being here as well.
Good to be here. Thank you.
So to our viewers, if you'd like to ask a question, please use the Q&A function in Zoom. And if you can, let us know who your question is directed to, and we'll do our best to fold your questions into the conversation. With that, Arthur, it's over to you, and I look forward to your discussion.
Thank you. Well, thank you both for joining the discussion. Dr. von Messling, I guess we should just start off by asking, what are the global public health priorities for Germany, for Germany's G7 presidency and for this summit? And which of these goals do you think are most achievable? I think you're on mute.
Sorry. Yes, that had to happen. So I think Steve already mentioned it. It is, of course, yes, one of the big priorities is pandemic preparedness and really putting some action into this buzzword. And then it is a long-standing German commitment to AMR, to antimicrobial resistance, and to preparing for the situation and dealing with the situation, often called the silent pandemic, because it is not as visible or as dramatic on the short term. And then, of course, literally dealing with COVID, because as it was just said, it ain't over, unfortunately. So what can be achieved? I think with these political processes, every G7 presidency contributes one more piece to that puzzle, or one more step to that process. And so I think this has been really championed by the Ministry of Health to have very specific, palpable commitments to pandemic preparedness. So the same is with AMR. There's been funding directed to pandemic preparedness initiatives, and there has been also funding directed to dealing with COVID, to supporting countries who are in need of support, because ultimately I think it can't be often said enough. We can only handle this if we handle it everywhere on Earth, and if we support everyone to be able to deal with this pandemic. So thank you.
Right, thank you. Dr. Lurie, what are your thoughts on this as a former official? I realize you don't speak for the U.S. government, but representing CEPI and just thinking globally, you know, what of these goals, how do you see as a path forward for the current period to sort of work on these incrementally or with bigger steps?
No, thanks for asking. Frankly, I think that anybody right now who is concerned either about global health or about their own domestic health security needs to care deeply about the kinds of issues that Dr. von Messling just raised and that are on the G7 agenda. You know, this moving the global surveillance efforts forward that are on the agenda are absolutely critical. They are key to pandemic preparedness. The sooner you know, the sooner you can start to tailor your preparedness activities for the pathogen at hand. They're also really critical to dealing with antimicrobial resistance in one way or another. And, as I think we'll probably talk about, those two issues are just incredibly linked. And I think the G7 is a terrific forum for moving these forward. And as Dr. von Messling said, for moving these issues along from one country to another, continuing to pick up new issues and new approaches, but being sure that there's some continuity there. And that's continuity in R&D. It's continuity in the broad outlines. And I also just want to say it's also continuity in financing, both for R&D, but for having a financial mechanism to respond so that we're not necessarily in the same kind of situation that we've been in through a lot of COVID, passing the tin cup.
You know, I was wondering, listening to this discussion, over the last couple of decades, there have been new structures, created like CEPI and Gavi, and I guess financing structures also that have helped during COVID and with other vaccine or drug developments. But I was just wondering, do either of you see this as from the experience that we've gone through with COVID, is there a need now for other sort of structural changes, or is it just a matter of degree and commitment, more money, more of this, yeah, I don't know who wants to take that on. I'll start with you, Dr.
I can maybe start from a like more governmental perspective. I think there's two levels, or at least two layers to the situation. One is, if we consider pandemic preparedness something that we do in support of low and middle income countries, then there is a certain amount of money a country will dedicate to that particular commitment, in general. And then the pandemic preparedness funds will be a piece of that pie, Mm-hmm. So one thing I think that is being discussed and that is really important is that we consider pandemic preparedness not solely as something that is done to support low and middle income countries in their health systems strengthening, which has to be done. I'm not saying that, but also that we do to prepare ourselves to prevent loss of life and loss of economic losses and other losses that incur in our own countries as well. And that then leads to other numbers, other commitments, and also other actors that are going to be involved, other mechanisms that will become active, because that is more a domestic type of financing question. And I think the challenge at the moment is to bring these two things together and make sure that every effort we make actually pays into towards that goal, that we are better prepared for the next pathogen or health crisis that might come our way. And the other layer is that there is, of course, always the desire to have something new versus to build and improve on something old. And I think there's a lot of cultural differences in the view. So Europeans might be more in favor of working with what you have and essentially developing it further, whereas maybe the new world is more open to, oh, let's just do something new and do away with the old. And I think international processes are very well equipped to kind of balance all of this out and work it out. We also have these initiatives now that were created during COVID, where the question is, are they actually holding water? So is it worth maintaining them? Or did they do what they were supposed to do? And it is time to end this and really think about more, let's say, sustainable structures.
Can you be specific about exactly that? Dr. von Messling, which structures are you talking about that
like, for example, Act A, right? So that was very useful. And the question is this something to build something more sustainable on, or maybe rather build something new altogether or strengthen something old? But I'm sure Dr. Lurie has their own views on that.
Sure, go ahead, Dr. Lurie.
Yeah, I think you actually framed it really well. And I guess I don't necessarily see it as an either or. There are some really important parts of the way things have been done in the past that are clearly worth maintaining, some that are clearly worth strengthening and need to be strengthened. And then, as we've seen during the COVID pandemic, the systems that we had a lot of gaps. And Act A came together and COVAX came together to fill some of those gaps. And I think it's fair to say everyone has learned a lot from the experience. And so rather than bake in where we are now, I think there are some important questions about how do we move forward from here, building on a set of really important platforms, but working to fill in some of the gaps and address some of the things that didn't work so well. One thing that I'd really like to highlight in that regard is, when we talk about all of the preparedness initiatives, we talk about strengthening country capacities, and Dr. von Messling just talked very nicely about those things. We talk about R&D a lot, and we at CEPI are very focused on the R&D part as part of preparedness. But I think one of the things that we learned from COVID is that when something happens, we're actually not really well financially prepared. And Act A came together and COVAX came together and have spent inordinate amounts of time and energy passing the tin cup to try to finance a lot of things that were needed to move forward, whether it was in buying raw materials and manufacturing and making investments at risk and procuring products for countries that didn't have the resources to develop them themselves. And all of that meant that all of the stuff that needed to be done happened really late. And obviously we know it led to a lot of inequities and, much further spread of the pandemic, and it's still with us. And so if I'm thinking about a new structure, I'm feeling as though we have both the issues that we talked about in terms of preparedness, and then we have some issues, and key in my mind is the financial structure for making sure there's enough money to do this the next time. I mean, this pandemic.
To sort of have a permanent COVAX fund, although it won't be COVAX, it'll be called something else.
I think there's a pretty strong sentiment that you don't necessarily want money sitting around in the bank, not working, right? And so you need to have some kind of a mechanism that, other countries and the international financing institutions can agree that it's pretty turnkey. That, if somebody wants to go borrow money from a bank, especially if it's in the many billions of dollars, it's not going to happen in a matter of weeks. Mm-hmm. And so even if everybody has good intent, it's taken months, maybe well over a year. So you have to have a much more turnkey mechanism for that stuff to happen. Setting that up as preparedness, activating it as response.
Okay, right. Maybe a related question from someone in the audience for Dr. von Messling. Is Germany planning to advance the financial intermediary fund at the World Bank in some ways? Are you pushing for more funding for it from other G7 members? I think this is related. I don't know what this fund is myself, but I'm sure you do.
I do, but I think it's too early to say. I think the negotiations are still in very early stages, so there's nothing specific that I can add today. Sorry.
What, Dr. Lurie, were you saying something or no?
No,
Okay.
I wasn't. I mean, I think that I would agree that it's early. I think the fund is an interesting idea. There's a lot to wrap one's arms around about what it is going to be for and how it's going to work. I know the US government has made a down payment or committed to make a down payment, but still a lot of open questions.
Well, let's talk a little bit about vaccines and what we learned. So when the COVID vaccine started becoming available in late 2020, G7 countries were accused of, vaccine nationalism or, withholding promised vaccines. There's been so much that's happened since then. There's been a lot of discussion about vaccine, technology transfer. There's been some agreements. There's been some movement, and currently seems to be a vaccine glut, demonstrated by the fact that, at least as of a couple of weeks ago, Gavi had sort of put a hold on some of its vaccine orders from manufacturers. I was wondering, maybe to start, Dr. Lurie, what would you? Is this all a question of timing? The fact that now there's a glut, and that, if these vaccines had been available to larger parts of the world earlier, what are we to make of this whole set of events, sort of?
Well, I think it's a really complicated issue. And I think, I think we have to start with the premise that it is every country's leader's responsibility to take care of the people in their country first. Mm-hmm. There's also the premise that we're all interconnected. And, the pretty much cliche now that none of us are safe unless we're all safe. So if I think about what happened in the beginning, high-income countries made advanced orders for vaccines. And remember, when these vaccines were being developed, nobody had any idea if anything was going to work or what was going to work. And so the high-income countries had a lot of resources, and they hedged their bets, and they made advanced purchase commitments or advanced orders for lots of different kinds of vaccines because they didn't know what would work and what would work best, et cetera. Partway into this, obviously, COVAX and the Gavi facility got stood up, and there were commitments of funding to Gavi to make vaccine. But Gavi can't go spend money it doesn't have in the bank, right? And so at the end of the day, they ended up sort of toward the end of the line with high-income countries not only getting vaccines first, but left in a situation where they had ended up, ordering 2 or 3 or 4 times as many doses of vaccines as they needed, and they all worked. So suddenly you had this gigantic glut of vaccines there, or whatever it was. They were all concentrated in the wrong place, and there was a huge amount of scarcity for other places in the world. If you then compound that with a bunch of the issues about export controls and other sets of reasons that doses didn't get to Gavi, stuff just got there way too late. And now what we've seen, and we've seen for the last number of months, is a lot of countries with way too many vaccines are more than happy to either give them to the COVAX facility or go directly to the countries and say, please use my vaccine. I don't want to be stuck with leftover. Better COVAX be stuck with leftover than my country be stuck with leftovers. So it's a very complicated situation. And I think there are a number of things to take from this. One is this early financing is really important. And the issue about avoiding as much as you can the upfront scarcity by having much more distributed manufacturing capacity, if you can sustain it, will be really important.
That's really interesting. There's so many issues here. Maybe Dr. von Messling would be interested in talking about this also. Given that countries are going to first serve their own populations, as was amply demonstrated now, are we shocked that this is the way things have turned out? That, in a way, it's quite positive that we ended up having enough vaccine for the world. It's just that it's not distributed, and it's partly because it's the types of vaccines, right, that turned out to be produced most quickly, right? That the mRNA vaccines are harder to administer or to distribute in some countries, and I mean, no one could have really foreseen that, right?
I mean, I don't think we're shocked that countries need to take care of themselves first. And I think we're shocked that all these vaccines worked as well as they did.
Right.
And I think that's been a really terrific thing. And this has been a much more dangerous situation, but if you compare how long it took H1N1 vaccine to get out of the US and get to other countries, it took a lot longer than it took the first COVID vaccines to get to low and middle income countries. So fair to say that we've made some progress, but in the beginning, there was a huge amount of scarcity. And had we been able to deal with that scarcity and get vaccines distributed much more quickly and evenly, I think we would have been in a different place. So some is about money, some of it is about export controls, but at the end of the day, it's about scarcity. And if you can make more vaccines faster or whatever works, that's going to be a really important way to help deal with this going forward.
Dr. von Messling, your thoughts about this?
I completely agree. I think it's really important that we look at this realistically. And in contrast, let's say, to drugs that you give to the people who are actually sick, which is hard enough. Vaccines you give to people who are not sick. That means everyone potentially is a vaccine recipient. That means also it's a numbers game. There's no way ever, no matter what we do, that we will be in a situation where we have a vaccine for every single person on Earth within a very short period of time. But that shouldn't be discouraging us to think about exactly the things that Dr. Lurie was mentioning. So we have to be honest and say in a situation like that, it is a combination of being able to actually produce things rapidly, as fast as possible, thinking about prioritization that can be geographically, like where the outbreak actually is, or where it actually is not yet, whatever, like it will very much depend on the pathogen. And also on the ability, how much we can produce, and on the safety profile of the vaccine, and on the kind of disease that is being caused. And to make this a bit more palpable, let's talk about Zika. So that was a disease where the biggest risk was for pregnant women. So that was a group of individuals so the prioritization was completely different than it was for COVID, for example. So it's very difficult to talk about this in very abstract terms, because every one of these outbreaks is different. But the recognition that it is part of my responsibility as a government to take care of my constituents, and that includes taking care of their health and well-being, is maybe has come home to all of us, no matter if we are LMIC or industrialized, whatever it is. And so that a larger part of the resources has to be directed towards that aspect. I think that has been realized, and this geographic distribution also makes a lot of sense, and people have actually thought about it. And if you think about drugs, just as another example, so a lot of the drugs that are needed for example, for HIV treatment are being produced not just in certain sites, but in industrialized countries, but really worldwide. And we have to think about this for vaccines. It just isn't that simple.
Is it happening with vaccines, though? I mean, it seems to be, you read about things happening, and I always wonder, because I know how complicated it is to make vaccines, but you see that there's reports South Africa, Senegal, Burundi, maybe, and then, all over South Asia, obviously, for many years they've been doing these. But it does seem like there's been a stimulation of this kind of distribution of production, right? I mean, is that
I think
something we
it's
can
easy to
expect
say.
for the next pandemic?
Yeah, I think it's very easy to say to state that this is what should happen. I think it is very, very difficult to do this. And I just want to remind people of that yellow fever production site that's been developed in North Africa for many, many, many years with lots of money and lots of expertise. And and
no vaccines.
Well, they may come online now or have come online, but that's not because of a lack of commitment or effort, you know. So this is really hard, and or just think of the beginning of the pandemic when AstraZeneca was producing the vaccine and it wasn't giving the yield that they had expected. These are professionals. This is what they do all their lives. It is really hard, and you have setbacks. And so I think this is a project that will require a very long-term commitment if this is serious, and it will require a long-term commitment of the countries where these facilities are being built.
Mm-hmm. So I might just add one other dimension to Dr. von Messling's comments, and then maybe some of her comments about Zika and high-risk populations back to this earlier discussion about the old and the new. So, you know, the other thing I would just say, there's a lot of interest now, as we all know, in distributed manufacturing capacity around the world. A lot of effort underway. A lot of countries have put money, and financing institutions have put money into this. But remember, for those things to be sustained, they're going to need vaccines to make. And right now, that's somebody else's market. And so the issues about sustainability are going to be really important. I'm pretty struck by the fact that, at least for most of us, and certainly for CEPI, you know, when you decide on you're going to make a vaccine, you invest in a whole portfolio of vaccines. We did it for COVID. We know it takes usually 9 starts to get to a successful vaccine. The world is invested in a whole boatload now of new manufacturing facilities. They're not managed as a portfolio for the world. They're each sort of one-off projects. And they're not managed so that at the end of the day, you look at the whole portfolio and say, I'm going to get some success somewhere. And so I think we have some work to do there. But let me go back
so are you saying that we need to, that the world needs to have sort of a warp speed approach for kind of...
I mean, yeah, I think the world needs to get its arms around how are we sure that some of these are successful, and how do we help them be successful? And for the ones that are not going to be successful, how do we recognize that and deal with it, recognizing that all these countries want to be able to make vaccine. And it's not as though you can mothball a plant and then stand it up and think it's going to produce when you have a crisis. We saw that didn't work in this pandemic in really developed countries, in the US and in Europe, right? So big issue there. But I want to go back to this other issue for a moment, because I think Dr. von Messling raised a really important issue about sort of the set of issues around prioritization. So Zika was an example where you needed to vaccinate pregnant women as a priority group. In COVID, it's clearly been older adults and people with chronic illness. Our world vaccine system, as it was, the old system to build on, is built on, and not inappropriately, but is built on childhood vaccination. And we don't necessarily have a global infrastructure to vaccinate adults, vaccinate healthcare workers first, identify and vaccinate pregnant women first. So part of thinking about building for the future is not to say out with the old and in with the new, but this has taught us that as part of the infrastructure we have, we need to make some improvements. And my major hope is that we don't lose interest in doing that as the COVID pandemic subsides. And ultimately, frankly, if you do that, then if and when we ever have an HIV vaccine or the TB vaccine or whatever, then you've also got the platform to vaccinate adults.
So this is a good opportunity to think about building on top of the pediatric.
And then you have a market for these new vaccine manufacturing facilities. So they're all related. It's a bit like a three-legged stool in that regard.
Yeah. So I have a I was going to turn to this subject, and a viewer has written, I'll just read their question, which is, applauds Germany for keeping antimicrobial resistance at the top of the G7 agenda. There have been encouraging statements from ministers, most recently by health ministers from G7 on this, but we need to create market incentives. What can we reasonably expect from the next G7 summit with regard to concrete proposals for market incentives? Dr. von Messling, I was going to note that in the US, we have the Pasteur Act, which to me doesn't seem like it's going to make it in this year. I guess it could, but it would do exactly that, of offering incentives. And I know in the UK and Sweden, there are already smaller programs that do that. Is there a broader move toward this in the G7?
So honestly, not that I am aware of, but that may just be that, as you rightly pointed out, this is the Minister of Health who is planning this, and I am the Ministry of Education and Research. So just because I am not aware of it doesn't mean that there is not something being discussed. Germany, I think, has the view on AMR is that, and what this refers to is the question of push and pull. So it is the question, first of all, can we, and Germany is a very strong proponent of the push part of it, because the pull part of it is hard for us in our healthcare financing and reimbursement system. So every country has their own way of paying for healthcare, and in ours, it is a complicated process or a complicated concept to have a pull incentive, whereas in the British system, they found a really elegant way to do so. So I think, so I wouldn't want to reduce it to this. These are particularities that they'll always be there. I think the big part is, to my view is, or my perception is, the AMR world, there's essentially two groups. One group that is really in putting their money and their efforts on, let's get new antibiotics. And a second group that feels, oh, most important is that we make sure antibiotics are used appropriately and as sparingly as possible. And this will be the game changer. And there's really strong arguments for that particular approach, and they are not an either or approach. And so for Germany, we have a two-pronged approach on this. One really is that all that goes under the stewardship umbrella, and the other one that goes also in funding research and development, discovery of new molecules, but also modification of existing molecules so that they have a broader or an added value. And also, but that is really research, not so much development, other innovative ways of dealing with infections, be it by vaccination, be it by, for example, phages, things like that. But here we are really talking about research. We are trying to learn and to understand how else can we deal with multi-drug resistant infections. And when we talk about the drugs, just the last point, I think in the last years, these efforts internationally have really led to new target molecules being discovered. After a long time, new antibiotic candidates are going into the pipeline. So now the question, how can we get them into a licensing process, and how can we actually get them into use, is essentially the next level. And so you're totally right. We need to think about how can we make this attractive for companies to actually carry these products. Right. But first we had to actually have them. And so this is what we've been focusing on in the last years.
So now we're on the verge of having, and in fact, there are some that have gone on the market and the companies still fail because of, right. Dr. Lurie, you're shaking your head like you have something to say about this.
Yeah, no, I don't know that I have much to add. That's exactly right. And I think Dr. von Messling laid out this dilemma in some sense, which, isn't how the market works, right? The market works that you develop something and you go sell as much as you can. Here, we're sort of saying, well, why should I develop anything if I can't sell it, as much as I can? You know what, I was thinking back though to my time in US government when, we were charged ironically, for biodefense reasons of coming up with some novel antibiotics against anthrax. And we sort of said, well, gosh, if we're going to put all this money into developing novel antibiotics, let's see if we could also develop novel antibiotics that would treat your resistant gonorrhea, that would treat your resistant urinary tract infection, that would treat your resistant pneumonia. And that's really how the AMR program in BARDA got started and how CARB-X got started. And those, again, are important investments and R&D and a little bit of the push mechanism. But as you noted, two things happen. Number one, even if you get stuff out the other end, there's not a market for it. And so far, a lot of the stuff that has been successful have been a little bit me too, slight modifications that don't add huge value to what's already there, but they're expensive. And that's another challenge with the market. And so the ideas of getting novel compounds or novel approaches are really important. I think, in the past several years, and we've seen it in COVID, we've had some really gigantic breakthroughs in science and in the kinds of enabling science that will let this happen better. One of them is a much better understanding of structural biology so that you can really think about how you target organisms differently. And we'll have to see how this all plays out. And the other, frankly, is the use of artificial intelligence that lets you try all the different combinations and permutations of everything under the sun. In some way, that's obviously a glib misstatement of what it is, but really helps you, filter to a point that you might be working with some promising stuff. Over.
But the question is just, those are all going to be important in the research. The basis for really interesting research is clearly there. But are we in a situation? Sometimes it sounds like it's the boy who cried wolf with antibiotic resistance. But on the other hand, there are people dying of this, and the drug companies aren't charities, and so as they are often pointing out. And I guess, Dr. von Messling, you were sort of saying that each healthcare system has its own, or each country's healthcare systems are set up in different ways. And so there might not be a really obvious way to do a pull mechanisms. In other words, to get some of these developed drugs out onto the market in a unified way, it sounds like is what you're saying.
So I think we have to, you are asking the right question. And one of the things I frequently say is, let's make new mistakes. So this is a problem, it's been a problem for a long time. And it's this problem of market failure.
Right.
And so on the one hand, so we have to maybe look at what are the business propositions in this particular space. And clearly the classic pharma company business proposition doesn't work if we want to take stewardship seriously. So we need to think or come up with new ways of the different actors finding a way of making it work. And it is very clear that a commercial entity needs to make money. They can't do it as a pro bono. They can occasionally, but that is not a sound basis for such a situation. So I think some of the things, pull mechanisms can come in different forms. Maybe this is what I'm trying to say. And part of it is that maybe it's other actors that are attracted by that market. Maybe the market is that you produce it and you have it you store it. Maybe you are a smaller company that is also producing other things for clinical trials, and 2 months of a year you produce a batch of this antibiotic and you get paid for it. And worst come to worst, whenever it expires, you destroy it appropriately. And that is part of your business plan. I mean, you will immediately see that I'm not an entrepreneur. Yeah. But the point is I think these are the things that we need to discuss about. And this is certainly not the solution, but maybe that is one way of thinking that can lead to a solution. Or we can have it be that like for some TB treatments where you get paid for successful treatments. And that is an interesting business proposition. And one point I would like to make is as non-pharmaceutical or non-commercial entities pay for parts of the development of these drugs, the cost recovery that is necessary for a company to ultimately make this an interesting business proposal changes. And we maybe need to discuss that as well in that whole picture, and figure out for which type of company could this be a good business model. And I think this is happening. So I'm not just making this up. I think this is happening all over the place. And then also, could it be that there's one company that produces it, and maybe a larger pharmaceutical company gets paid for having it as a global distributor? And things like that. And I think a lot of these organizations, like, for example, GARD-P, are exploring these things. And yes, sometimes things fail, but it's like when you learn to walk, right? Sometimes you first stumble and then eventually you walk. So I'm quite optimistic that exploring this further will lead us to figure out ways to be successful in this space.
Great. I think I should thank you so much for all these really interesting points. I know that some of the listeners and are interested in it. It's also really important to bring up the whole issue of food insecurity and how the war in Ukraine is sadly adding to that. And so what can be done at the summit later this month to shield the world's poor from the worst of this problem? And are there sort of longer term lessons to be learned about making the world more food secure when you have unexpected events like the Russian invasion? Dr. von Messling.
I think that's a really hard question for me, at least, because that's not what I usually mostly have to do with. However, what I can say is that a big part of this as well is taking it. We cannot only deal with it together, and I think there's a big push to do exactly that. And we need to think of what does it need to make sure that this situation does not lead to horrible crises and or to, let's say, people taking advantage of the situation and raising prices unnecessarily, and so making it even worse. And I think we may have to think about in the long term, how can we, now I'm making this even a bigger question. So with the changing climate, how can we make sure that we still have enough to eat? So we have a growing world population. We seem to, currently it looks like, as the temperatures rise, we are losing space that could potentially grow food, and we don't want to destroy forests or things to then grow food there. So we need to think about how do we make the most of this space, of the agricultural space we have, and research and all these technologies we talk about in the vaccine context may actually also help us there, help us to find plants that can do this. But it's really very different from AMR and vaccines. So yes, I'm not a specialist there. Sorry.
Yeah, no, that's okay. I mean, I don't know if this is really an area that we can, but I guess it does seem that, food is health, and
Well, I think it's really on everybody's minds, and I think the estimates now, right, are that the food crisis could also precipitate a mass migration, crisis of what do we hear the estimates? 100 million people, right? And so then you sort of come full circle back to the climate issues, the vulnerability issues, and all the kinds of both infectious disease issues that come along with mass migration, and the poor immune function issues that come along with malnutrition. So they're not really disconnected, but they're really, really, really hard problems.
Yeah.
But so I think that we need to address it. So we don't solve it with looking backwards. We have to solve this with looking forward. And so we need to, like we did with COVID, we need to put our heads together and try to figure out how we make sure there's enough food for us. And so, I mean, just to give a few buzzwords, vertical farming, you know, I recently saw a really cool project with underwater farming, things like that, yes, that is currently, I mean, I think vertical farming is really taking off. I think there's other types of farming may be a few years out, but we need to put our minds together. And I think that's what COVID has really shown, that we are able to do so. And then we are able to go beyond the wildest expectations in terms of what we can actually achieve, because nobody would have thought that we are able to have vaccines in such a short period of time. And a big part of this was luck. Let's not kid ourselves. Yeah, big part of this was luck, but not everything. And the fact that we are 2 years in the pandemic and we now have too much vaccines, that's a problem, but that also goes to show what we can actually do. And that spirit, I think we have to bring to the food crisis as well.
Yeah.
Yes.
Wouldn't it be nice if we had too much food soon also? Well, I was going to ask a couple of the questions have come in from viewers. Someone saw the recent announcement around the G7 Pandemic Preparedness Pact. Last year, the UK had a major focus on the 100 Days mission. The viewer is curious whether the pact will build on the 100 Days mission and will there be a role for the private sector in providing feedback to the pact. Does that mean something to you, Dr. von Messling?
Oh, yes, it does. Again, I have to bring up as an excuse that this is a different ministry that is doing this,
okay.
Yeah. But I can say that, yes, it does build on the 100-day mission. And I would be very surprised if there was no space for private companies to be involved and to comment. I think the pact itself, the wording, often these texts are negotiated amongst the political leadership. And so, but then this is the umbrella under which action happens. And this action will definitely never exclude private or companies. So every help is needed or every support is needed.
I'll just say from the CEPI perspective, obviously we're deeply involved in the 100-day mission. And, for people who are not familiar with what that is, it is really the goal to be able to make a vaccine against a novel agent in 100 days. I mean, right, this time it took us 327 days, which was historic, but still a lot of people died. But let's also remember, and this is again, private sector comes in a couple places. That would be the time to make a vaccine and have it authorized for use. I want to also start to think about what happens in that second 100 days, because that's when all those issues that we just talked about manufacturing and not having scarcity are really going to come into play. And so I think, CEPI works a lot with private sector companies and with universities and others, lots of opportunity for input and collaboration, both around the R&D for vaccines and frankly, also about the manufacturing innovations that are going to be needed to make vaccines better, faster, cheaper, closer to the source, all of those things. So, the pact is a pact between countries, but all kinds of organizations, mine included, play a really important role in operationalizing the ideas that are in that pact.
Dr. Lurie, I wanted to ask you, this is related to earlier discussions, but I think it probably would be of interest to viewers to hear about it. When we were talking about how, just the amazing speed with which COVID vaccines came out and CEPI's contribution to that really through research and funding. And then we get into the area of antibiotic resistance and it's, I mean, every year maybe it's a dozen organisms that are sort of the worst ones. So what kind of possibilities are there for vaccines to be developed against them? And we have a streptococcus vaccine, but I don't think we have a Staph aureus vaccine, which would be for MRSA or against any of these others. What are the prospects there?
Well, I think it's a great question. And I think there are, a number of people who are working this in an R&D mode. I think there are a couple of things to keep in mind. And we just talked about, all of these issues with the market. If you were to develop a vaccine, is there a market for it? How are you going to use it, et cetera? And remember that antibiotics are things that are given to sick people. Vaccines are things that are given to healthy people. And in order to prevent an infection, you have to have the vaccine. You have to give it to lots and lots and lots of people, most of whom will never develop the resistant organism. And you have to give it well enough in advance so that if they develop that resistant organism, they have immunity. And as we looked at this a lot when I was in the US government, and it was really hard to think through completely the public health case for thinking about doing it for some of these populations. And then he said, well, what if we only focused on the elderly or focused on people in nursing homes? Mm-hmm. Those are people who've got not the greatest immune systems often to begin with. So it makes the development set of issues more challenging, not insurmountable. And I think there are great ideas. I would be totally remiss if I didn't point out that meningococcal vaccine, pneumococcal vaccine, things that we use day in and day out to prevent childhood illnesses and some illnesses in adults, pneumococcal vaccine, have really made a major contribution to reducing antibiotic use and antibiotic resistance. Mm-hmm. And so there sort of is a role, but like any of these issues, there's just not a straight line from here to there.
Right. Yeah. Dr. von Messling, I know you were at the PEI all those years. So what do you have thoughts about this issue for vaccine development?
I can add a few. Sure. I can add that we already vaccinate chicken against salmonella, so people don't get salmonella and things like that. So there is smart ways of dealing with this. I think there is, in the mid future, we will see therapeutic vaccines where this problem that Dr. Lurie mentioned is addressed. But this is research, right? There's no products immediately there. These are ideas that people are exploring, where there's promising data, where there's promising proof of concepts. But from a proof of concept to a product that's licensed, that's a long, long way. And that is, I think that we will not solve AMR by some magic bullet antibiotic. We will solve it by all these things coming together, and stewardship is one, and testing and knowing what the bug is actually resistant to and what it isn't. And so there is a lot we have to do, or we can do, and then it goes on. And there is evidence very clearly that if you have proper hygiene, if you have proper surveillance, then you have less multi-drug resistant infections and less death from that.
Right. Let's see, I have a final question, I think, that is tricky, but I'm going to ask it anyway. Sorry, So the US, the G7, and other countries recently called for Taiwan to be invited to participate at the most recent World Health Assembly. It's excluded from the WHO and most global bodies because of objections from China. The proposal was rejected on May 23rd, it says. Will the G7, sorry, this keeps jumping up. can we expect anything on this at the summit? Can be discussed or?
I have no idea. I'm sorry.
Okay. No,
I
it's
understand the question. I would be curious too. I have no idea. I have no insights on this. Sorry.
Okay. All right. Well, any closing thoughts about any of these issues, vaccines in particular, or sort of what we've learned from COVID experience with and global vaccine initiatives?
I'll just say, I think the future in this regard is really bright. We have seen a lot of triumph of science and of research, and I expect that we're going to see more. There's been an explosion in new ways of doing things. There's been an explosion in global collaboration around solving really hard problems. And, you know, despite all of the hand-wringing about vaccine nationalism, I think that there are some really, really promising ways forward. And I really like the way Dr. von Messling put this, that, you know, we all got to put our heads together. We all understand that we all live in a really interconnected world. And even if sometimes our governments and our leaders are slow to figure that out, the public is not, scientists are not, and problem solvers come from everywhere, all over the world.
That's great. Wow, some optimism. Wonderful. Thank you. Dr. von Messling, any closing thoughts or?
I couldn't agree more. I can only add, it's just, we aren't dinosaurs, right? We are able to adjust to new situations and deal with them. So
Great.
I'm optimistic as well.
Thank you both so much.
Well, my great thanks to all three of you for this incredible conversation. I certainly have learned a lot. I think our viewers have as well. And what I particularly appreciated was, you know, you're talking about some really big challenges that we have to face and some really dire situations in certain places when it comes to public health. But to be able to end this conversation on an optimistic note makes me feel much better about the state that we're in. And your conversation today has just underscored for me, for our viewers, how important transatlantic collaboration is and collaboration in general when it comes to meeting challenges that know no international boundaries and that can spread. I mean, as you were both saying, we live in an interconnected world, and so we need to be working together to meet these challenges. So on behalf of both the German Embassy in Washington, D.C., as well as the American Council on Germany, I want to thank both of you for sharing your expertise with us. And Arthur, I want to thank you for just masterfully leading the conversation and guiding the conversation today. A really big thanks to all three of you for participating in this discussion.